Hello and welcome to this clinical skills tutorial about the third stage of labour. In this video we're going to be primarily focusing on the active management of the third stage. Preparation for the active management of the third stage of labour involves ensuring informed consent, having all the necessary equipment prepared, administration of an oxytocic agent after the birth of the baby, and observing for signs of separation of the placenta. You need to be sure that you select the appropriate personal protective equipment for this clinical skill. You may need more equipment based on an individualized assessment of the woman. However, you will need at least an apron, goggles, gloves, both sterile and non-sterile. Almost all of the equipment that you will need to actively manage the third stage of labour is present in the delivery pack. This is a sterile procedure and you will need to maintain strict aseptic technique throughout. You will need a receiver for the placenta, some gauze balls, a cord clamp, an artery forceps, an umbilical cord scissors, and a sterile towel. The second component of the active management of the third stage of labour is early clamping and cutting of the umbilical cord. With informed consent, you should inform the woman and her partner that you're going to clamp and cut the umbilical cord. You should apply the plastic disposable clamp close to the navel end of the cord. Be sure to stay 3 to 4 centimeters clear of the abdominal wall to avoid pinching the skin. A greater length may be indicated in some circumstances, for example preterm deliveries. A second clamp, usually an artery forceps, is placed closer to the placental end, leaving about 2 to 4 centimeters between it and the other umbilical cord clamp. You then use the umbilical cord scissors to cut the cord between the two clamps. Make sure that you shield yourself and other personnel from blood spurts as you cut the umbilical cord. Before you deliver the placenta, you should place a clean incontinence sheet underneath the woman. In order to proceed and deliver the placenta, you first need to make sure that the 3 signs of placental separation are present: that the uterus is well contracted, the cord has lengthened, and there is a small trickle of blood. You will have now removed your non-sterile gloves, performed hand hygiene, and applied your sterile gloves. Inform the woman that you are going to place your hand gently on her abdomen. In order to maintain sterility, you will need to put the sterile towel on the abdomen first. Place your non-dominant hand on the fundus of the uterus. The uterus should at this stage feel contracted, hard, and round like a cricket ball. Place your non-dominant hand above the symphysis pubis, with the thumb and fingers outstretched. You should inform the woman that she will feel some pressure as the placenta delivers, and it also may feel uncomfortable. Grasp the cord with the dominant hand and apply controlled, steady downward traction. Whilst exerting pressure on the uterus in an upward motion. It is important that this pressure is maintained while exerting downward traction. If you need to move the clamp or your hand further up the cord, you should always release traction before releasing the upward pressure on the uterus. This is essential in order to prevent uterine inversion. You should never apply traction to the cord without exerting pressure on the uterus in an upward motion. Note when the placenta appears at the vulva. You should then change the direction of the traction, moving upwards instead of downwards, and this follows the sacral curve. The membranes should be delivered slowly to avoid tearing. You can also use a twisting action here, or perhaps use the artery forceps to help coax the membranes out. The important thing is to take your time. You then should place the placenta in the receiver and note the time of the delivery. Now that the placenta has delivered, you should continue to assess the condition of the woman. You should palpate the uterus gently to ensure that it is contracted below the umbilicus, whilst assessing the amount of blood loss. You should remove any soiled pads or linens and replace with fresh ones. You should then attend to hand hygiene and prepare to assess the genital tract. Before you go to examine the genital tract, you should first explain the procedure to the woman and gain informed consent. Perform hand hygiene and apply sterile gloves. Assist the woman into a recumbent position with her knees bent, ankles together, and her knees parted. You also need to ensure that you have good lighting. Inform the woman that you're going to cleanse the skin with some water or other cleaning solution. And this is to make sure that the external genitalia are clean. Again, you're going to swab from anterior to posterior. You'll swab again towards the right side and towards the left side. You should wrap a piece of sterile gauze around your fingers. Inform the woman that you're going to check using your fingers and some cotton gauze and that it may be uncomfortable. You could offer the woman some Entonox gas for pain relief. With your non-dominant hand, you should separate the labia gently and systematically examine the vulva from anterior to posterior, noting any trauma. Using your dominant hand with the sterile gauze, press down on the anterior, lateral, and posterior walls of the vagina and observe for any trauma, changing the gauze square as necessary. Then you will move on to examine the perineum for trauma. With consent, you should check for damage to the internal and external anal sphincter using your little finger. The assessment of the genital tract is now complete. You should assist the woman into a comfortable position and attend to her hygiene needs. Remove your gloves and attend again to hand hygiene. Explain your findings to the woman. Perineal suturing should be undertaken at this stage. You should also assess the woman's need for analgesia. You should now move on to systematic assessment of the placenta for abnormalities and also for completeness. You should then proceed to document the management of the third stage of labour and the assessment of the placenta. You have now reached the end of this clinical skills tutorial. You should now refer back to your lecture notes and also to your core midwifery textbook for more detailed reading about the anatomy and physiology, and also more detail about the care and management for both physiological and active management of the third stage of labour. You should also refer to the relevant guidelines, policies, procedures and protocols in relation to the management of the third stage of labour. Bye for now.